The following program is a Town of Colonie television production of the William K. Sanford Town Library.
Welcome to Albany County News. I'm Mary Rozak, the Director of Communications for Albany County. And in the next 30 minutes or so, I hope that you'll find a very interesting program and something very insightful about one of our Albany County departments. Today, we're going to be talking about the Albany County Health Department and its brand new commissioner. So joining us today is Dr. Elizabeth Whalen. Welcome.
Thank you, Mary.
You have been, it seems for all of about 2 minutes, but there have been so many things that you have done in the last several months. You've been on board since June, I believe.
May. I started mid-May, yes.
Okay. So you've had a lot on your plate.
It's been busy, but it's been very exciting as well.
You are a physician, was a practicing physician.
Yes.
Talk about the difference between actually either going to a hospital or a practice every day and what you do now, going to the health department.
Sure. Well, I think a lot of people are very familiar with the traditional model of a physician in clinical practice. You see patients on a daily basis. You treat patients one at a time. You may work in a hospital. You may work in a practice circumstance. But public health is a little different. So in public health, instead of taking care of one patient at a time, we do what's called population health. So we look at communities. And it's a much broader perspective, but it's also an opportunity to be impactful on a broader level than you can be as a physician in practice.
You are very personable. It's got to be a little bit tough not seeing patients every day, though, not having that kind of very personal interaction with patients.
I do miss that. I really enjoyed the time that I spent in practice developing relationships with patients, but I do get to do a fair amount of community interface in the work that I'm doing now, too.
Sure. Now, it would not be appropriate to start this interview without talking about the flu. It's flu season, and I know flu season is a very long one, so people tend to forget. How long is the flu season?
Well, you know, funny enough, people are talking about flu season starting now, and it has. Flu season usually peaks in February and can go on. We can see cases as late as April or May. So it's important for people to start thinking about being prepared now.
Okay, let's talk about being prepared. Everybody thinks about flu shots. Mm-hmm. Obviously, I would think that's probably one of the number one preparation modes, right?
It absolutely is, and we would encourage people now to start getting their flu shots. A lot of times what happens is people wait until they hear something about flu in the news or some concern they may have with having been exposed to flu. And really, once you get the vaccine, you still need about 2 weeks before it becomes effective. So getting it earlier is a better idea.
So I get a flu shot today. For the next 2 weeks, I may have already been exposed. And for that 2 week period, right?
For full effectiveness, it takes about 2 weeks.
Wow. Now, there are all kinds of things that we hear about. Each year we hear about maybe a smaller needle. We hear about the flu nasal mist. Mm-hmm. How do we know what is the right thing for each and every one of us? And I know you're going to say talk to your own doctor, but how do we go about navigating that even before we get into the doctor's office?
Well, I think that there are choices available in some circumstances is the bottom line. A lot of people don't like needles, and for them, the nasal mist might be an opportunity. But again, it depends on your past medical history. It depends on previous history of asthma. So it really is an important discussion to have with your provider.
I know that a lot of times people see the commercials all the time mm-hmm. about being able to go into a pharmacy and get your shot. Is that something where someone just all of a sudden you wake up and you say, okay, maybe I should go do that, or really should you check with your physician first, or is that something that people even do anymore?
Well, people can do that. I mean, obviously, I am going to recommend people have a close relationship with their primary care physician, and for people who get flu shots at the drugstore to be able to let their physicians know about it. But the opportunity to get that flu shot at a place where people may have easier access than going to their doctor's office is a great opportunity. And I think that that's a good project to have in the community. I think people can go into pharmacies and get the flu shot. It's really not a high risk situation. It's easy to go in. Pharmacists have all been trained and licensed that are administering the vaccination to do what they're doing. And it's a great strategy to really make sure a lot more people are vaccinated.
So you do think by your last statement, you do think more people take advantage and get shots because of the availability factor?
I do.
This way.
Yes.
What about those people? I know that every year we hear the news stories about this strain of flu is not, it's not included, or it's only 70% effective, or I think last year, and I don't want to throw out, numbers that are incorrect, but I think last year there was a real concern about being covered by the flu shot. And,
that's right.
Yeah. Talk to me about your experience with taking that gamble and getting that flu shot versus not. Even if the news is saying, well, it may only have 50% of what we think the strains of flu are this year.
Right. So first question is, how does that happen? How does it happen that the flu shot doesn't match up to the flu strains that are in the community? And how that occurs is because of the technology that it takes to develop the flu shot. So we're on two different hemispheres. As you know, the southern hemisphere has a different flu season than we do by nature of their seasonality. And the way that flu shots are developed is that we look at, they take about 6 months with egg-based technology, and we have to look 6 months in advance of what the flu strains are in the southern hemisphere, and that's how we use those flu strains to develop the vaccination. But flu is a tricky virus, so it can mutate very quickly, and sometimes we find out that when we get that around to that vaccination time, when the vaccine has been prepared and is ready to be distributed, that it's not really a match for what we're seeing in the community. Most of the time it is. And actually, I can give you some good news because some recent data has come out to suggest that this year we've got a good match. So we know that now, so of course we'll be encouraging people even more to get their flu shots. As far as vaccination versus non-vaccination, when you know that there's maybe a question there, it's always better to err on the side of safety.
Okay. There are all kinds of other things that I've I walk into my drugstore, and now they also are offering other kinds of shots. I think I don't know if it's a pneumonia. I'm trying to think of what it is.
Yeah.
Yeah. Who's a candidate for that? I mean, really. I don't. Other than seeing it up there, I haven't stopped and said, "Oh, wow, maybe I should be getting this here."
Yeah. So the Pneumovax is a shot that is, again, it's dependent on your age and your past medical history. It's usually for older individuals or individuals with medical comorbidities, and that's something to talk to your doctor about, or again to the pharmacist. And we're seeing an increased number of vaccinations that pharmacists will be able to give in the future. An example we'll probably be seeing more of is the vaccination for Herpes Zoster, or for the Shingles infection too.
Okay. And let's talk a little bit about that, because now there are commercials on all the time. I have never known so many people who all of a sudden have had shingles. Growing up, you'd never hear about that, and yet now it seems like everyone knows someone who's gotten it.
Well, a lot of times the incidence of these diseases don't change that much. It's just that there's a lot more attention to them with advertising campaigns. We do see that more in an older age group, so that vaccination in particular is recommended for individuals over the age of 60. Again, it's something that you should discuss with your primary care doctor, or can discuss with a pharmacist as that rolls out.
Mm-hmm. You'd never know that I don't like needles. We're talking all about needles. While we're still on the subject of needles, let's talk about immunization. I know it's gotten some recent play in the news about across the country in various places where those parents who don't want their children immunized for various reasons. The issues come up again because now some of the reasons that were out there before that they could use are no longer available, and so some states are doing that. Immunizations in general, as a public health practitioner and as a practicing physician, Talk to me about the need here in New York for immunization.
Yeah. I think this is a particularly important discussion to have in this current generation because a lot of people who are parents now of young children were not around at the time where a lot of these very serious and debilitating and even fatal diseases caused a lot of disease. So there's been a certain degree of complacency, if you will, that's come into society where people think, well, that hasn't happened in a long time, so I don't have to be concerned about it. There's that piece, and then there's the piece of concerns that people have of vaccinations being related to conditions such as autism, which has not been scientifically substantiated with numerous medical studies to back that up. So these concerns together pose a significant risk because a lot of these conditions are highly communicable. Vaccines aren't a perfect strategy, and vaccines in some cases over time can wane. So even one case of something like measles can cause a significant public health risk because of the degree of communicability and the degree of illness that it can cause.
Interesting. Do you get questions, or have you? I know that and if you haven't at this point, it's okay. But do you get questions that people call in and ask the health department things along these lines?
We do. We get those kind of questions on a regular basis. We have a wonderful epidemiology unit who deals with the majority of these questions. But I know I've been called on to answer them too.
How often?
And the health department's a resource for that. So if people do have questions, they should know that the health department is a resource to answer those questions.
And that's what I was going to ask you. What kinds of things? I mean, virtually anything they probably could call health related and ask.
Well, I think if you're looking at the the departments that we have in the health department, we have the epidemiology department would be concerned with things like communicable diseases, with things like vaccine preventable diseases, with issues like foodborne illnesses. Our environmental staff takes a number of questions on, environmental concerns, risks that the public has to different agents that they could be having access to through water or the air that we breathe in. We have a preparedness division, which deals with questions of how to prepare for emergencies, how to prepare for multiple different emergencies, whether they be natural or otherwise. So there are multiple different questions that we are a good resource.
Sure. And we just wrapped up National Emergency Preparedness Month in September. And I know that one of the things that Albany County does is put out a calendar.
That's right.
So we've got a new one to look forward to.
Yes, we do.
I know that's coming out in January. We are talking with Dr. Elizabeth Whalen, the Albany County Commissioner of the Health Department. And one of the big stories in New York State in the last probably 2 months has been Legionnaires.
That's right.
Grab the headlines. You traveled to New York City. You were instrumental in calls and discussion about how to work here in Albany County with what may or may not happen, how to work with the state. Tell me a little bit, first of all, about one of your first reactions when you heard the word Legionnaires, because we know when people hear Legionnaires, the average person, you freak out. You think, oh my gosh, there's Legionnaires here, someone has been very sick. We think of Legionnaires in Philadelphia, how many decades ago, and the people who died. What was your first reaction?
Well, I think the first reaction in hearing Legionnaires isn't always a surprise from a health department perspective. It's a fairly ubiquitous organism, and we do get cases of Legionnaire's disease and Legionella every year. But this year, it was a little bit unprecedented. Actually, it was very unprecedented to have the number of cases that we saw in the Bronx. So that was a surprise. That has not occurred to our knowledge in the past, and it was a very unique set of circumstances that caused this to occur. Again, Legionella is not a communicable bacteria, so if I have Legionella, I cannot spread it to you. It's you get it through water or through spray of water. So in the circumstances that occurred in the Bronx, there were cooling towers. Legionella is a pneumophilic bacteria, which means it likes water, and it likes to grow in water. And what happened was that in these cooling towers, the Legionella bacteria multiplied, and as the cooling towers do their work and spread a spray of water, people that were walking under that breathed this bacteria in and became ill. Now, usually people that get ill from Legionella have pre-existing medical complaints or are older individuals. So people that have lung disease or that happen to smoke or have a number of other chronic diseases or are of a certain age tend to get sicker than other people. So I think that pretty much was the case here, but it obviously shined a big spotlight on this particular condition.
Certainly. Now, there are things that that the state had said, should be done in registries and things, and of course, Albany County and you in particular with the health department said, yeah, we're going to stand right by that. Talk about some of the procedures now that are in place.
Right. So I think that, one of the concerns that they had with this particular outbreak was around the maintenance of cooling towers. And there are standards that are recommended for people to be using to kind of clean and disinfect your cooling tower type systems. But they were recommendations. They weren't regulations. And some of the systems, particularly in older buildings, may not have been maintained. So the thought was to use this opportunity to revisit that process and make sure people are held accountable for maintaining the systems that they operate. So from this perspective, what they decided to do was develop a registry because we didn't know, even in Albany County, we didn't have a list of where we have cooling towers. So the state developed a registry so that we would have this list and know where these devices are, and then to determine the best protocols to maintain them. And there are previous guidelines that the state now recommends that people use and are trying to implement it more from a regulatory perspective to ensure that these towers are maintained appropriately and obviously to decrease the risk of something like this happening again.
All right, so let's say some towers in a particular building are tested, and what would be the procedure, let's say, if something came back and it were found that there was the presence of Legionella?
Well, the first test that the state did in their free testing was a screening test. And if the screening test came back positive, then they recommend that they do another test called a culture. But they recommend right away on site to get the engineers to look at who's maintaining the system and has it been maintained to date and to do what's necessary in order to maintain it. And from there, obviously the risk will be decreased.
Sure. So necessarily it doesn't mean if there's a positive screening result that people have been exposed or are walking around and they're, I don't want to say they're glowing, but there's going to be an issue and you can't go near them. Yeah,
it doesn't follow necessarily that a positive screening test would indicate a risk to people passing by. As I said, this bacteria is ubiquitous. It's in soil, it's in water, it's in other systems besides cooling towers, and generally it doesn't cause disease to the degree that we saw in the South Bronx.
Sure.
That was a very unusual set of circumstances, and I imagine epidemiologists will be puzzling over that for quite some time to be able to figure out how that perfect storm occurred.
Sure. And I just made the same misstatement that many other people make by saying you can't go near that person because you've said how many times you catch it in different ways.
Right.
Let me ask why this is not common, let's say, or why this doesn't seem to happen in people's homes. I mean, we have shower heads in our homes, we have hot tubs. Why might we not see or hear about something like that happening in, a residence, a private home?
Well, there's possibilities that it can happen in that kind of system, because as I said, generally in systems where there's hot water, where you have some stagnation, where there's a buildup of scale and stagnation, these kind of opportunities create an opportunity for growth. We do see this from time to time, but really the reason that these kind of outbreaks get more attention is because it's an aggregate setting. So you haven't got that many people showering in your home. We're talking about multiple people that were exposed to a single source.
Gotcha.
But still, it tends to be, it's not something we see that frequently.
Okay. Speaking about different things that when we talk about food, I know there are a variety of things that the health department does, including restaurant inspections.
That's right.
And so I know that those are done on an annual basis, and I don't know where we are in the process at this point, if they're ongoing or if they're
ongoing.
Okay.
Yeah, staff is out inspecting on a regular basis all the restaurants in the county.
So there's the restaurant inspections. There are also inspections, I know, cannabinoids. That you had recently done. I know that every so often, Albany County has been at the forefront of going out and doing those kinds of inspections. Anything new that you found?
Well, as far as synthetic cannabinoids, that's becoming a bigger health concern in New York State.
And I am making an assumption people know what synthetic cannabinoids are. Would you explain?
Sure. So cannabinoids are marijuana-type drugs, and synthetic means that they're lab manufactured. Mm-hmm. So we're talking about something that's different from the traditional marijuana that's grown. These are chemically manufactured drugs that are being marketed and sold in different ways, sometimes in stores, and they're very dangerous. So there has been a big spike in hospitalizations in New York State and serious complications from ingestion of these substances. So there is a big public health effort to become educated on it, to learn more about it, and to consider how we're going to address this strategy in the community.
The spike was throughout the state, but not necessarily in Albany County, correct?
We have seen numbers in Albany County, but there are certainly other parts of the state that are more affected than we are at this time. But we want to be aware of this and do what we can to prevent this from being a problem in our community.
Okay. How tough is it to actually go out? And I know that sometimes things are called, the names seem to change rather frequently. Mm-hmm. How tough is it to actually spot these things? It's like a living document. It's constantly changing.
Yeah, it's difficult because these substances can be manipulated at a molecular level, and often what's happening is that this is being done and they're being marketed in different substances with different names. So it's very difficult to keep track of the substances and what names that they go under. And this is something that we're really starting to look at to determine best measures to go forward and control this.
Okay. You are the commissioner, but you're not new to Albany County and the Albany County Health Department.
That's right.
Let's talk about a little bit about this is your second time around.
Well, second time around with the department,
Yep.
First time as a commissioner. So I was very fortunate to have the experience of working at the county health department from 2003 to 2009 as a medical director. Mm-hmm. And at the time was involved a lot with communicable disease, but did do a lot of preparedness work because it was post 9/11, so a lot of our efforts were focused on that. I learned an awful lot while I was there, and I'm very happy to have the opportunity to come back and be commissioner. It's a wonderful staff.
I was going to ask you how things had changed, because post 9/11 it must have been a very different focus.
Mm-hmm. It was. I think that, we spent a lot of time, and we still obviously spend time nationally on a state level and local level with the difficult questions of preparedness and being prepared for multiple different potential scenarios. But I think now we're starting to return back to the important basic public health functions that the health department was founded on. So, making sure people have access to care, providing those important linkages to people, educating people on communicable disease concerns and vaccinations. We have clinics that deal with TB, with sexually transmitted diseases. So there are a lot of other things about the health department that I'm happy are being focused on now as well.
TB, you just don't hear about that anymore in TB clinics. When you just said that, that's something that I was not aware that we were doing. How prevalent is TB?
Well, active TB is not very prevalent. We don't have many cases in the community, but certainly with TB, and I don't know if you've ever had a PPD test done on your arm where
they have like the little marks after. Yep.
So a lot of people who are particularly a lot of immigrants will have had prior exposure to TB.
Okay.
And what that test does is determine whether you have had exposure to TB. And in that situation, it's very rare to go on and develop active TB disease, but it is suggested that you receive a course of medication to prevent you from going forward to developing TB. So, most people that work in healthcare have to get those PPD tests. Okay. And so we follow along with people, that have the positive PPD tests that need the treatment, and in certain cases where we do have active TB, we follow that along as well.
Okay. You have a large responsibility. The health department. I mean, we have 310,000 people in Albany County. Say the health department has a large number of staff, but it's probably never big enough. What we would need. What do you see as the biggest challenge? As we're winding down in the last couple of minutes for you at the health department and for the health department in the county?
Yeah, that's a tough question. I think, I'd say the biggest challenge is advancing the whole strategy of preventative health care, of really ensuring people take seriously the routine tests that they get, the screening tests that they need, of trying to keep themselves healthy, of controlling blood pressure, of really stopping diseases from becoming chronic and more severe. So I think education is always a challenge. It's always a challenge to encourage people that are basically healthy to take that important strategy of trying to keep themselves healthy and taking their health seriously as a priority, as well as people that have diseases such as diabetes that can be very time-intensive in terms of management, but we know that tight control of things like diabetes can really prevent long-term complications. Mm-hmm. So I think that those kind of educational pieces and those strategies, as well as linking people to getting care that aren't getting care, so in our underserved communities, to make those links and encourage people to become invested in their own health. I'd say that's probably the biggest challenge.
So what I'm hearing from you as we wrap things up today is go to your doctor, see your primary care physician, right? Think about preventative health and wellness. And if you have questions, certainly call the health department.
That sounds good to me, Mary.
All right. AlbanyCounty.com, always the place. You have a website that's robust with information.
Yes, we do.
On the health department. And we're going to have you back here and hear about the numbers come spring to see how we actually did with the flu shots and get an update on a variety of other things.
Thanks, Mary.
Thank you. We've been talking today with the Commissioner of the Albany County Health Department, Dr. Elizabeth Whalen. I'm Mary Rozak from Albany County, and we hope to see you again here very soon.